Good morning, everyone. I came across this meme yesterday. I'll read the bottom part of it. You read the top part of it if you're interested in the whole thing. I think it is apropos. But here we go. Face coverings, masks are an ancient tool used to break people down psychologically. This is the beginning of deleting individuality. He who does not know his history is certainly condemned to repeat it. And I think that that's very true. If you don't know what happened in the past, if you don't know the atrocities that happened less than 100 years ago, then I mean, from Hitler to Pol Pot to the killing fields in Cambodia. We're extending a little bit, but my goodness, like the history is rife with the evils that men do to one another, right? And everyone is caught up. Everyone is caught up when somebody goes power mad. And unfortunately, I've used the analogy before of we're a log in a stream heading for a waterfall, and we're going to read about this and. It's not going to be good. This isn't going in a great direction currently, right? We need a big outside force to change the direction of where our log is headed at this point in time, or our twig, whatever. Edmonton police, city of Edmonton is tweeting. Enforcement officers will be doing face covering compliance checks in YEG shopping centers and on YEG transit. Help reduce the risk of spreading COVID-19 and do your part by wearing a face covering. It doesn't work. Face coverings don't work. Here's Millhouse. He says public health officials in Canada have flattened a lot of things: business, family incomes, children's educational opportunities, the will to live, but the curve ain't one of them. Here's an article. Here's another. He's responding to data in another tweet. An article published by CNN on 9/10 says that Canada flattened the curve. Within days, the growth rate started to explode in Canada, and cases are up 963% since this article was published. Here's the data, and here's mapped masked work study. Yes, look at that. Very, very, very steep curve. My goodness. And it's all cases. And the cases don't have to be symptomatic in order to count. You just have to have a positive PCR test. And I looked at yesterday the reasoning and the math behind why the number of positives is much higher, and why it's likely driven. These case numbers are mostly false positives because of the high testing numbers, right? It's wild. Breyer's theorem, I think that it is. Global Canada, and it's got a at and Twitter here, appears to be the funder of the Canadian Shield strategy, essentially a COVID-0 rebrand supported by Ontario Science Table members. It seeks extended hard lockdowns Canada-wide. Global Canada is funded by the Bill Gates Foundation. Global Canada, GC, is run by Executive Chairman Robert Greenhill, and he's got Twitter links here. Mr. Greenhill is a former high-ranking official at the World Economic Forum, serving as Managing Director and Chief Business Officer for 6 years until 2014 when he founded Global Canada. Now, here's the thing. My quick question. This health table thing, right? Say you get rid of Doug Ford. Say you say Doug Ford. And hypothetically, I don't think that Doug Ford is the hero here, because if you're the hero, you're standing up for your citizens more than Doug Ford has. Open the businesses. This is ridiculous. Say the emperor is not wearing any clothes and open your province. But say that he's the best of a bad bunch that you could possibly pick from, and this is where he's been able to hold the line, right? He's got in a lockdown gray, but we're not really in a lockdown gray, except that the restaurants and the bars and the salons and all that other stuff are all closed. But the case numbers are going up, and they're ignoring all of the treatments that work. Oh man, I'm gonna say I've got the new medication, but HCQ, other treatments that work, not vaccines, tested drugs that are tested and safe for humans. Who knows if somebody else would inherit the health table, right? So like, say you put Andrea Horvath in there, and the health table says the only solution to this is hard lockdowns, and she says 100%, everybody has to self-isolate in their bedroom by themselves with nobody else, period. And if you don't do that, we're going to take you to the isolation center. Nobody said that, but hypothetical, right? What happens then? How are we able to say, get a second opinion? This is insane. How do you say this? They've been ignoring it. They don't care. And they've got a 100% fear tap turned on all the way. Turn on your radio. Turn off your radio. If you're listening to the radio, if that's your main source of listening, turn it off. Honestly, get a playlist, get an old iPod that doesn't have an internet connection, get a playlist and plug it into your car, because the radio is awful, but it's always the same thing. It's the same as when you're walking in a store. We want to keep you safe. Keep 6 feet apart, blah, 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 blah. Wear your mask. If you can't wear a mask, get out. Bull. It's garbage. These initiatives clearly don't work. Clearly, they don't work. As like this is a bad representation of the numbers. I guess it's not so bad, but still, the amount of cases is exploding, and that doesn't mean that there are a lot of sick people necessarily. It just means that there are a lot of cases being positive. And I would love to know the numbers of how many sick people there are within those cases. I would love to know how many people are just positive with no symptoms, how many people, and then let's test their close contacts to see if asymptomatic people spread anything. The Wuhan study said no. Right? So anyway, so if a bad government inherits this awful health table, how do you get rid of this health table? How do you get rid of the influence of these people who obviously have conflict of interest, who obviously have an ulterior motive to lock people down? They want to lock people down. Locking healthy people down is not an appropriate way to fight a health crisis. This is not how you fight health crisis. Quarantine means healthy means you lock sick people up, and you don't have to lock them with a key, but you say self-isolate until you feel better, and when you feel better, come back. And if you need to have an intervention or a hospital or whatever, then we'll take that, or we'll take you there. But otherwise, self-isolate. But you should not be self-isolating in your home for the rest of your lives. We should have a better plan 10 months into this. This is insane. So how do you get rid of these crazy people whose crazy ideas absolutely should not be taken seriously? Back to the Twitter thread. Sorry, that's a big aside, but still, this is important. Okay. And I'm not going to be distracted. We're going to talk about travel, but initially, when I built my video, I had travel at the beginning, like all this travel garbage, because they're hypocrites, right? And it's a popcorn story, right? It's easy to report on because they're so hypocritical. But that's not the important story here. Everybody who's reporting on that is missing the important story of the removal of our civil liberties. For what? For what? It hasn't worked yet. It hasn't worked in Toronto. It hasn't worked in British Columbia. It hasn't worked yet. And they say, oh, it worked in Victoria, in Australia. It worked there. No, they have a flipped seasonality on their flu. Right? They're coming into summer right now. Right? December was the height of their summer. They have Christmas on the beach, right? Watch the Wiggles. But honestly, it's a seasonality thing. It has nothing to do with their lockdown working. It has everything to do with them changing the standards. Maybe they lowered the PCR threshold or started testing only sick people. That'll have the numbers, I'm sure. I wonder how many people are sick. How many people are they testing are healthy positives? What's the ratio? Why don't we know? Okay, back to this. Global Canada GC was founded in 2015 and has since received grants and disclosures on the Bill and Melinda Gates Foundation website. The first two were in November 2015 and 16 and a total a modest 1.3 million. More on the third and more recent grant in a moment. Global Canada has hosted Bill Gates on an honorary dinner in February 2015, shortly after its founding. Here are Mr. Gates and Mr. Greenhill together. Pictures. Global Canada appears to have not been very active since its founding. Here's the entirety of its news and highlights since 2014, but recently it's become very active. Sorry, just loading the rest of the thread. Apologies. After a long year of dormancy, the Global Canada org Twitter account perked up and on October 14th, 2020 retweeted Robert Greenhill, its executive chair, asking if Canadians should go for zero. The account has not tweeted since November 2019, except a couple unrelated tweets in September 2020. Since then, the account has been very active, retweeting the director as well as several COVID doom tweets regularly. Inspecting Mr. Greenhill's Twitter account, you would find a similar pattern. General COVID and other issues pre-October 2020 only had COVID zero post October 2020. What else happened in October 2020? Global Canada got its third grant from Bill and Melinda Gates Foundation, its first since 2016. Then in November, Mr. Greenhill was interviewed by Natasha Fatah at the CBC, where he advocated a harsh lockdown policy. At the end of the interview, he was evasive when asked about collateral harms of lockdowns. Recall that the Bill Gates interview on December 13 told Jake Tapper he thought that normal was still a long way off, perhaps 12 to 18 months, and that sadly bars and restaurants, small biz, would sadly have to remain closed. Now, within the last 72 hours, Mr. Greenhill and the COVID Strategic Choices Group, CSCC, first tweeted December 30th, 2020, are promoting the new Canadian Shield strategy. Remember, the CSCC Canadian Shield is funded by Global Canada. This heavy PR campaign includes this 25-tweet thread done yesterday, January 1st, by Mr. Greenhill, and the tweets by Ontario Science Table member D. Feisman that I retweeted yesterday. The CSCC Canadian Shield Group, which appears well organized, includes many of the media and Twitter celebrity folks from the medical community that you may expect, some of whom are likely colleagues of the members on the Ontario Science Table. The Canadian Shield Group has made it clear it wants full nationwide lockdowns, and here it is. the image of their website with a link to the website. It says the geographic variation and optimal policy highlights a potential difficulty in coordinating a Canadian Shield or Melbourne model strategy across all provinces without a mandate from the federal government. So they're looking for the federal government to mandate a full lockdown of the entire country. Earlier, I tweeted about the, in my opinion, rather amateurish analysis of the group's lockdown goals are based on, and he retweets his earlier retweet. Back to Mr. Greenhill, who in 2017 gave a speech for an event sponsored by the Canadian International Development Platform, CIDP. CIDP was also partnered with the Gates Foundation and another peculiar organization called the Overseas Development Institute. Here's the homepage of the ODI, quite an interesting agenda indeed. Priorities for the Biden-Harris administration. Global reset, statement, UK ends support for overseas fossil fuel projects. Oh man, climate change and global warming meet health and safety, right? It's for your health and safety, for your continued planet that we have to destroy your economy, your culture, and everything that makes your country and the place that you live unique. We just got to destroy it all so every cog in the wheel can be replaced, right? They just got to replace it. They just got to destroy it so they can replace it. And make sure that you're masked so they don't recognize if there's a change, right? It's wild. It's wild. Back to Global Canada, who has a research fellow on staff named Celine Huerta for a nonprofit who's aiming to promote Canada's involvement on the global stage. Her personal Twitter account is rather political. She's entitled to her opinion, of course. So Global Canada, an apparently relatively inactive, lightly staffed nonprofit funded by Bill Gates and run by a World Economic Forum veteran, has taken a recent grant and invested in a new, now heavily promoted Canada-wide extended lockdown initiative. What is going on? What is going on? What is going on? Lockdowns don't work, and yet we're forcing them. Here's a thread about the impact of lockdowns on school children and why, and the hypothesis of the thread is why we need to keep schools open. I'm not going to go through. Well, I'll go through a few of them. My kids are in school, and they're not in school this morning, and because of the extra week that we were told in November. They were having arguments about it in November. Should the kids be on extended break and blah, blah, blah for a circuit breaker? They use the same language in the UK. This is a UK Twitter thread anyway, I believe. But as London's got their K-6 school canceled. But my concern is they're funneling all of the kids onto an online platform. And if they decide to extend this lockdown, it's very easy to say, well, we could just extend the kids at mandatory education online because it worked so well in that first week, right? Garbage, absolutely garbage. I've not seen any studies comparing K-6 online schooling versus in-classroom schooling, especially kindergarten, especially the early grades. I will not have my kids experimented on. This is irresponsible of the Board of Education. This is irresponsible of our provincial government. This is irresponsible leadership. It is not good leadership. These people are not trying to help us. You cannot replace an economy with government handouts, and you can't replace school with one-to-one time on a Google Meet. It doesn't work. And there's a big difference between one-to-one time at school or being in a classroom and having one-to-one time on a computer with the teacher. What happens if something in the background happens that the teacher doesn't agree with, right? Parenting or something is said by a parent or a sibling comes in naked, whatever. There are all sorts of privacy and other regulations, and not that I'm concerned about that, but I understand. I worked in child protection. I understand the implication of privacy and privacy violations and the duty to report. There are all sorts of, it is a can of absolute worms. It's an absolute mess what they're doing. And either they're too stupid to realize it, or they're being told that they have to do it, and they have no other choice. If it was me, I'd quit. F them. I would quit. I was talking to my wife yesterday. We were walking around with the kids, taking them out for their playtime or whatever. And I said I would quit if I was a teacher, because for a while I wanted to be a teacher as I was a youth care worker. And I said I would quit. I would tell my principal where to go. I would tell my students that they're lying, and I would walk out. And she said, "I know, dear." And I thought that was funny. I was like, "Oh, okay, right." And she said, "You did that. Like, you left because they were lying." And I said, "Oh yeah, you're totally right. I did." But honestly, it is so important to have the interactions, the ability to figure out your place on the playground, right? Like, that's something that I can't teach. I can teach my kids the ABCs. I can teach them how to read. I can teach them how to speak French. I can teach them all of that stuff, but I can't teach them how to interact in society and figure out how to excel and how to choose the thing they want to excel at, how to choose to be who they want to be. I can't teach them that. right? And they have to discover that. They have to be given the independence to discover that. And if we're all locked down, if everybody's locked down, and people are saying homeschool, 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 sure, okay, fine. But if we're all locked down, where's the opportunity, right? Where's the opportunity to bring them into the community and to have them interact with people in a normal way? It's gone. It's being robbed from us. They're taking it from us, and it impacts every facet of our lives. If you have young children, if you have teenagers, I mean, if you're single and a teenager, right? You should be dating, you should be figuring out who you are, trying all that stuff. You should have a job. Again, it's that independence thing that you can't just learn sitting at home. You can't learn on a computer. It's stealing from everyone. The people in the old age homes, their last Christmases have been stolen. The kids who are on the cusp of university and college, their young adulthood is being stolen. This is being stolen from us with zero data to back it up. These liars, these craven liars. Okay, back to this. Updated thread, the impact of lockdowns on children and adolescents 2021. A group of UK academics who work with children and adolescents concerned about the lack of focus on the needs of this age group in policy making during the pandemic, we provide scientific evidence that might help redress this imbalance. Dr. Helen Dodd wrote about the importance of F2F play. Without the opportunity to play closely with peers, children can feel lonely and socially isolated, which is linked to short and long-term mental health problems. Another contributor wrote on the impact of children missing school. Conclusion: the consequences of a large gap in schooling are waiting to be documented, and these effects will occupy social services and mental health specialists for many years to come. So the impacts of what we're doing to these kids will keep a lot of people busy. Highlighted the impact on teenagers. Research has demonstrated the crucial importance of social interaction and social learning in adolescence, which is a sensitive period of social brain development. You farm out your sanity. Your group tells you how crazy you are, and to rein things in. People will actually directly tell you. If you say things that are too far out of their norm, they will tell you, wow, that sounds a little nuts, right? Bring it back, buddy. That doesn't necessarily mean you're nuts, but you internalize that and think, okay, I need to re-examine. I need to prove what I believe. And either to yourself or to your group, you try things out. If you are robbed of your group, it's very difficult to figure out the world. Right? And maybe this is the point. I don't know. Here's another three contributors wrote about the mental health crisis in young people, concluding ensuring safeguarding bereavement and mental health needs are promptly identified and evidence-based provision is made available to those who need it. A child and adolescent mental health crisis, that's from. And there's many more. There's a lot of proof that what we're doing is very, very damaging. Not only to individuals' mental health and mental well-being and growth and development, but also to businesses. When you destroy somebody's ability to make money, when you take somebody, if I've seen businesses that have been long-standing community pillars since the 1600s in Britain, right? There was a 600-year-old something or other bar that closed down because it couldn't make it work, because the management structure, I mean, you can't have a year of salary, you can't have a year of rent just stacked up. And I mean, maybe the bar owns the building, but somebody maybe took a loan out or whatever. Regardless, if ski hills can't operate, Canada's Wonderland, right? At what point does Canada's Wonderland go, oh, well, I mean, I guess we can't open because, COVID-19 cases keep going up because the damn bloody test is wrong. Regardless, I guess it'll just turn into houses because it's more valuable to the developer as houses because, you can lock people in there. Can't walk around Canada's Wonderland these days. Can't go skiing. But don't worry, we can do all sorts of other stuff. Masks work and social distancing work. But here's the NHL. Oh wait, no. Where's the NHL? Hold on a second. Yeah, people in Calgary are being arrested for playing hockey. But here it is, breaking news. Premier John Horgan says the province will allow NHL teams to play in BC this season with enhanced safety measures. So if the enhanced safety measures work for superstars, can we use the enhanced safety measures too? Or they don't work for us because we're just regular people and we don't get to be treated like the big star athletes? It's the big star athletes can play hockey, but the OHL guys can't. The OHL guys can't play hockey, and the AAA and on all the way down, you can't even have outside hockey, but these guys get to play hockey. Yeah, rules for some people and not others is not okay, right? If it's all shut down, it's all shut down, right? Some people, the differential is not fair, and it should be fair. This is interesting as well. There are doctors advocating, there's a change.org petition to silence Randy Hillier, right? Please join Ontario's doctors and nurses in silencing Randy Hillier. Read and sign. You're over the target, sir, when people are doing change.org petitions to silence you, right? He says doctors advocating for the silencing of debate and oppression to their quackery. As these same doctors collect their handsome taxpayer incomes and keep their offices closed, they are being paid to do nothing and want to keep it that way. Yeah, I mean, it is very, very frustrating when people who have zero impact on this, it's not their business closing, it's not their paycheck being impacted until hyperinflation kicks in, and I hope that it does not kick in, but until they start to feel the pain, they will not even understand the damage they're doing, in my opinion, unfortunately. Anthony Fury says, one bit of context that's pretty much never reported that I think would surprise a lot of people to learn is just how few of the new cases reported daily are among the age bracket most likely to have serious outcome. So all the new cases are in young people, right? Like you've got female and male, cumulative case count as of January 2nd, change in daily cases January 2nd. And you've got percentages of, or not percentages, you've got cases in like January 1st, January 2nd, and cumulative. And looking at 80 and over, there's only 13,000 cases, right? And if you look at the 20 to 39 and 40 to 59, you've got the large majority of the cases. But people at that age aren't dying. Right? It's a very interesting situation going on here. Again, that they're cherry picking data to continue to paint their story. Here's I don't know which vaccine this is about. This is a very important information about the COVID-19 vaccine adverse events. Verify for yourself, then share this information. To get the CVS spreadsheet, here's just download it from the government website. The government website is here. You have to enter your CAPTCHA, and then download the file, and I'll show you the file in just a second. But here's the synopsis, okay? The latest data from, VAERS report as of the 28th. The latest data from Health and Human Services shows that there have been 40,433 adverse events from the COVID-19 vaccinations in the USA. That includes 127 deaths, 769 cases of abdominal pain, 1,410 cases of amnesia, dizziness, disorientation, vertigo, confusion, and delirium, 1,500 odd cases of fatigue, along with 1,100 cases of herpes. The herpes was interesting. I thought, what kind of herpes is this? This is the kind of herpes zoster. It's like a skin herpes that just kind of manifests itself. Terrifying, right? Wild. Herpes. Along with 57 cases of blindness and deafness, along with 175 cases of eye swelling, eye discharge, and eye pain, along with tens of thousands of other ill effects. Oh, I forgot to mention, 127 deaths. Here's the chart. Here's the CSV. You've got symptom 1, symptom 2, symptom 3, and up to symptom 5. And like these all stack. Number 50 was one of the herpes, right? And my goodness, man. There's all sorts of scary things on here, and I don't know what to make of this. I don't know if this is Moderna or Pfizer. I don't know or AstraZeneca. I don't know which vaccine this is. I wish I did. That would confirm the story more for me. But the Health and Human Services, this one, this is very interesting. Very interesting information. I don't think this is a fully completed story yet, but. And not until I find out which vaccine it is. But very concerning, very concerning. There's a lot of medical professionals who are refusing the vaccine as well. So what's going on here? I know what's going on here. Okay. All right. Why does Canada need 400 million doses of the vaccines, right? Like we've got all sorts of deals. There were people, Adam Vaughan, I think from Toronto, saying, oh, the work that we've done to secure all these 400 million doses is certainly worthy of applause and praise and stuff. And why we're a country of 37 million. Even if we needed 2 doses, 38 million. Even if we needed 2 doses for everything, why do we need 400 million? And there was another tweet that Trudeau or somebody else said, we're pledging our extra doses to third world countries in addition to our contribution to COVID Vax Fund or something like that, COVID Vax or whatever, the fund that's supposed to bring it to the countries that wouldn't be able to afford the vaccine otherwise, right? Yay, more money shoveled out the door, but don't open your business. Don't open your business, right? It's very, very frustrating. Here it is. Important for the world as well as it's Bob Rae has announced vaccine surplus to Canadian needs will be shared with other countries in addition to our financial contributions to COVAX. Yay! More money out the door, right? None of it for Canadians. None of it for Canadians. Ivermectin, I almost got that one, is officially approved as a COVID-19 treatment in Macedonia as of today. If the indications in the local press are correct, Bulgaria will follow this week. Interesting. I wonder why we don't look at treatments. I wonder why we don't know how many sick people per day, like how it's just cases. And I wonder why we don't look at already approved drugs for treatment. Why the only thing we can do is these terrifying vaccines. And they are terrifying vaccines. It's like, I wish we had somebody we could call who was like the representative of patients, like a patient ombudsman. Oh, there is. CP24 is reporting Ontario announces death of patient ombudsman Kathy Fuchs. Yikes, that's not good. And the thing is, it would be like, unfortunate. When I heard this initially, I thought, maybe she's older and it was the kind of it was like the cherry on the top of a career here. But then I looked it up and I thought, nope, doesn't look like that, right? And the last line of the article is, officials say that Fuchs died as a result of a tragic accident, but provided no further details. Like, that's the beginning of a Murder, She Wrote episode, right? Like, oh, hello, Jessica. This is the old room of Miss Fuchs, who mysteriously died at the hotel. Dun, 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 right? Like, and then Jessica Fletcher accidentally solves the murder. Who knows? But weird thing to put in the article, right? I'll read the rest of the article here. Ministry of Health has confirmed that Kathy Fuchs, Ontario Parliament Ombudsman, has died. Named as the new voice of Ontario patients back in June, Fuchs assumed the role on July 13th for a 5-year term, bringing with her more than 3 decades of experience in advocacy. As with everything she did during her notable career, Kathy took this role to heart, making every effort to ensure all voices were not just heard but were listened to, Health Minister Christine Elliott said in a statement issued Thursday afternoon. During her short term in the role, Fuchs was responsible for investigating complaints about hospitals, long-term care homes, and home and community care, while also making recommendations to the government to prevent issues from reoccurring. Tragic accident. I mean, that's awful. That's awful. I hope her family is okay, and what a terrible thing to happen. But my goodness, maybe they could have ended the article in a different way. That's strange. Okay, moving into finances here. Meet the new boss, same as the old boss. I think there's hope. New Ontario Finance Minister Peter Bethlenfalvy to focus on economic recovery post-pandemic. So he's not doing anything yet. We got to listen to our health professionals for now. He acknowledged, and this is halfway through the article, he acknowledged that renewed and extended lockdowns now province-wide for all non-essential businesses. What are essential businesses? Who gets to decide what are essential businesses? Why do you get to decide what are essential businesses, Mr. New Finance Minister? Are painful for the affected firms, but he said the province has been taking advice from public health and medical experts when making such decisions and is providing millions of dollars in support to businesses, including grants and relief on property taxes and energy bills as a bridge to the other side of the pandemic. Can you please, Mr. Finance Minister, tell me the comparison between how much we're spending on testing and how much we're spending on supporting small businesses? I'd just like a running total as of yesterday. I would love to know that number. I would love to know how much we've invested in small businesses who have been forced to close due to bad government policy following flawed tests, and how much has been spent on the actual tests themselves. I'd be very interested, because I think it's like $1 million a day, $1.5 million a day I calculated. And so for 5,000 tests, it's much less than $1.5 million a day. But I think that at 50,000 tests, it hits $1.5 million a day at $42 a test, roughly, right? Rounding. So $1.5 million a day, running for how many months now? So let's just say since September, 30 days, 1.5 million a day, that's 30 odd million a month, 30, 60, 90 million for 3 months, over $100 million for just the testing. Is that close to what we're spending on the small businesses? Anybody? Back of the napkin, comment section? I'll pin it. And I love it's not our fault. It's the health experts. It's the health experts that are forcing us. Like, do people believe this? I'm going to go long today. Our decisions are very much driven by the health and safety and the guidance that we're getting from the experts. It's not our fault, it's the health experts, he said, adding that the government is also very mindful of the difficult environment that many families and workers and businesses across the province have to face. He said he believes businesses and workers in the province will prove to be resilient as his government unfurls more than $15 billion in supports over the next 3 years, as announced in November's budget, right? But what up until now? You've got enough money to spend $100 million on testing up until from September to now. How much have you invested in small businesses to prevent them from going under, to pay their rent, right? How much? How much? I feel like pure Poilievre. Catherine Swift says, really, Liberals, you don't recall the mid-90s when obscene government debt load initiated by Trudeau the first almost bankrupt Canada And the Liberals in power then had to rob EI, public sector pensions, and stiff the provinces on health and social services transfers to balance the budget. Many Canadians do. Max Fawcett is, I thought he was I thought he was referred to earlier, but he's not. He's saying history doesn't actually prove anything of the sort. And building your economy on the basis of things that happened in the 1970s and 80s is a good way to mess up the 20s and 30s. The problem with that is that things look very, very similar to what was shaping up in the mid-90s. And it was due to poor NDP governance in Ontario. And this is due to poor Liberal governance in the federal position. Anyway, Trudeau resides, moving into the travel because it is a story, and I think this is worth noting, right? Trudeau resides at Rideau College in Ottawa. His family resides at Harrington Lake in Quebec. In Alberta, I can't socialize with my kids who live in their own homes. Are such rules not in effect in Ontario or Quebec, which have far higher number of COVID cases? Please clarify. This is... Can you help me understand how it's unethical to socialize with one's own family within one's province of residence during the lockdown? Thanks for the clarification. So there was a tweet yesterday, and I had it. I guess these guys were arguing. Let me see. Hold on. I've got other stuff to do. Otherwise, I'd go and find this tweet. But yesterday, I was talking about how they confirmed that Trudeau was at home at Harrington Lake with his kids, I believe. And if he's allowed to go to Harrington Lake, why would anybody else be restricted in their movements, right? Like, why does Trudeau get to be treated differently? Here's the PMO lying. The PM has been in National Capital Region with family for the holiday. Does that mean he can travel freely between Quebec and Quebec and Ontario, or Ottawa and Rideau Cottage? No cabinet members traveled out of the country during the holidays. Only one minister traveled out of the country since restrictions were put in place in March. They say PF Champagne traveled for work. The PMO lied. There's a whole bunch of ministers that have come forward. Two more Liberals now. So here's the story. One of them, Brampton West MP, to step aside from parliamentary role after traveling to US for memorial. I like how they add the and Brampton West, right? Not Liberal Brampton West. I like how they add and this is Joe Warmington. It's for a memorial, so necessary, except aren't funerals canceled? Two Liberal MPs resigned from government roles after traveling abroad amid coronavirus. It's the same two, Kamala Kerr and Miss. Oh, who was this? Oh yeah, this is Kerr, and the other one was, I can't remember the other one's name. Well, there's a bunch of them, but this one covered specifically two. Samir Zuberi. Both of them were in different abroad places and came back. This one helped her daughter move abroad, and that was an essential trip in September, right? Like, we're locked down. She's flying to Ireland to help her daughter move abroad. Very interesting, right? Yesterday, the PMO said no Liberal MPs were out of the country, and here we are. CTV's fake news never puts the headline that it's a Liberal. Pierre Fons Dollard, MP, apologizes for traveling to US. So there's two at least. Oops. And here's another one. Who's this? The Premier's office asked Fort McMurray Wood Buffalo MLA Tanny Yo is currently abroad. He's in Mexico. They're trying to get a letter to him in Mexico. Liberal MP Lynn Bissetti went to Mexico in August to pick up her parents' car and other personal items they had left behind at the start of the pandemic. She also made a quick stop in Massachusetts to sell a house. I mean, totally necessary. I mean, this is an essential trip, right? Updated list of politicians if you want all of them. They're at the Winnipeg Free Press. This is Rod Phillips, and they're telling him to resign his MPP-ship. Yikes, says Joe Warmington. This was sent to me. My suggestion was to ask Rod to use his skills to help get people back skiing as part of his road to redemption, but some have other ideas. That St. Bart's trip probably sounded like a better idea than it turned out to be. Yeah, but now he's got no responsibilities, right? Yay, Yahtzee, right? Got rid of that pesky finance minister role just before things got real dicey, right, Rod? Morneau is a private citizen, says Pierre Poilievre. He is currently the Government of Canada's official nominee for the head of the OECD, with 19 federal public servants working on his tax-funded campaign. Is this him? Where was he flying? Maybe there's an innocent answer. Let's hear it. So it certainly looks like Bill Morneau. I definitely thought it was Bill Morneau, just from he looks like Will Ferrell. If I saw that, I'd be like, that's Will Ferrell impersonating Bill Morneau at the airport. Mexico's coronavirus czar takes a beach vacation in Mexico, in Osaka. I don't know how you say that. while the health secretariat tells people to stay home. So they think this is so serious that they're willing to get on a flight, risk their lives for a vacation in Mexico while they tell you to stay locked in your home. Because, the reason that the coronavirus cases keep peaking isn't at all because of the Breyer's principle. I think that's the Breyer's theorem, Breyer's principle. I'll have to look it up. I referenced it yesterday. But is in fact because you didn't listen to the directives. But these guys don't have to listen to the directives. They can hang out maskless in Mexico or by the beach, and the coronavirus knows they're important people. It won't get them, right? It knows. Here is Howard Anglin, and he says the federal travel advisory is about the dangers of travelers getting caught in an overseas lockdown or having trouble getting home, not about a public health risk. That is dealt with by the self-isolation requirement on return. So some context for people who are upset about people traveling outside of the country. The problem isn't necessarily that they're a further health risk. They mitigate that. Like they know they're not a health risk when they come back, and they probably have, they're parliamentarians, right? So they could probably call the whip and say, I was out of country, I can't be in until I finish my quarantine. And they would say, oh, okay, fine, no problem. So until this became a problem and Kenny issued no travel orders, etc., the travel advisory is for the public to understand that if you're at a resort in Mexico and they get locked down, I mean, it may get cut short or whatever, but it doesn't look like that's a problem, does it? Does it? Doesn't look like that. The ski hills, here is, I already talked about that, so that's an extra one. Here's Iran has resumed 20% enrichment of uranium at an underground nuclear facility, the government said on Monday, breaching a 2015 nuclear pact with major powers. That's an interesting timing to announce that, right? Are they that confident in Donald Trump? They couldn't wait like a couple of days? If they're right and Biden gets confirmed on the 6th, then, I mean, I think Joe Biden would come and cut the ribbon on the nuclear tests in Iran, don't you think? I mean, no, I don't know. Red line, right? No fly zone in Russia. Who knows? Who knows what will happen next? But it's an interesting timing for them to flaunt the nuclear rules. Who knows what's going to happen? I certainly don't. I really don't. Speaking of Trump, aren't the Lynn Wood tweets interesting, right? Who knows? Who knows what's going to happen? I certainly don't know what's going to happen, but it's going to be very interesting in the next couple of days. The reason being is the 6th is kind of proof is in the pudding. And then, I mean, the 20th is not all that far away. So who knows what's going to happen, but I'll keep watching. Thanks for watching me. Check out CanadaPoly.com, check out CanadaReport.co, check out SpeakingMoistly.co, and have a wonderful, wonderful day.